Okay, well, I know we're going to have a few more people planning on joining us, but let's get started. Good evening. Welcome to tonight's community Zoom meeting to learn about and share comments concerning the Brighton Police Department Police Reform Plan. That plan is issued pursuant to Governor Cuomo's Executive Order 203. The presentation is being recorded, and you'll be able to watch it again later on the Town of Brighton YouTube channel. Now, the draft police reform plan that we're discussing tonight, or as it's called, the New York State Police Reform and Reinvention Collaborative, is available for you to view on the town's webpage. The plan includes a number of important documents that are attached to the actual plan itself. Those attachments are significant underpinnings to the plan. They include a community survey that was done by RIT, comments from a community meeting that was held outdoors on the lawn at Temple Brith Kodesh, late summer, early fall. It includes a very thorough set of proposals for law enforcement reform that was issued by the United Christian Leadership Ministries. It also includes the report from the President's Task Force on 21st Century Policing that was issued by a task force appointed by President Obama. There are a number of other materials that are also attached to the plan. Chief Cathaldi is here tonight, and along with our two Brighton Police Department captains, and he'll be introducing the captains in just a moment. The chief will start with a PowerPoint presentation, and when the PowerPoint's finished, we'll open things up for your questions or comments. Now, I would ask that you please ask your questions using the Q&A feature at the bottom of your Zoom page. I'll be sort of moderating. I'll read your questions, perhaps not quite verbatim, but I'll read the questions so that the chief can answer them. Now, in case we don't get to your question tonight, we're going to try to wrap things up at about 8:30. Or if you think about additional feedback after we're finished, please don't hesitate to submit it. And you can submit any further comments at communityinput@townofbrighton.org. And with that, I'll continue and introduce Brighton Police Chief David Cathaldi. Chief?
Morning, everybody, or good evening, I should say. My name is David Cathaldi. I'm the Chief of Police. With me tonight is Captain Michael Zane. He's in charge of our Criminal Investigative Division. And to my left, your right, is Captain Jose Caraballo. He's in charge of our patrol operations, which is all the uniformed forces in the Brighton Police Department. I'm going to share the screen. As the supervisor said, I'll start off with a brief PowerPoint. It'll explain our plan. The plan has been out in the community since last Wednesday, so I'm really looking forward to this event. Looking forward to hearing some of your comments and suggestions in finalizing this plan, draft plan, I should say. As the supervisor said, please forgive any technical difficulties. I wish we were all in a room together or to where we could share and foster ideas across from the table. But in the year of COVID, it doesn't seem like that's going to happen. Let me first start off by thanking the town supervisor, member of the town boards, and trusting me in helping to draft this plan and present it this evening. I'm always humbled to be here as your chief of police. Without the support of the elected leadership in this town, we couldn't have such a well-respected police department. As we speak of technical difficulties. Are you seeing the screen? Mr. Supervisor?
Yes, but not in the full mode. I see the individual slides and there you go.
Let's try this.
Yep.
Oh, there we go. Sorry about that. So this is just an overview of our discussion this evening. I'd like to think of this as an opportunity to create positive change, not only in our agency, but a way to create stronger bonds between the police and the communities that we serve. Everything that you're going to read in this plan centers around what we've done as an agency and how we can improve our service to the community. I'd like to think that we're years ahead of the curve because community policing has been ingrained in everything that we do here in the Brighton Police Department. I'll discuss our efforts when it comes to training, to include our leadership training and how we have a culture that fosters those efforts. I'll also discuss some efforts when it comes to community engagement and the community outreach we have been doing for years. Lastly, I'll briefly discuss how the 21st Century Task Force on Policing has better positioned our department today. As you know, in June of last year, the governor signed an executive order requiring each chief executive from the local municipality to work in coordination with the chief of police to gather stakeholder input to examine policing in their respective communities. Our efforts in creating this draft plan started back in August, as the supervisor said, when we engaged with stakeholders at Temple Brith Kodesh to hear from the community, to hear their thoughts about community policing. And insight was gained about policing topics that aided us with what I have here in the plan. The draft plan will be out to the public for about 2 weeks, and after comments are heard, will be up for adoption, must be up for adoption no later than April 1st, 2021. Then, of course, the town has to certify it that it's completed the process. During the presentation, I'll discuss some of our organizational structure, the culture and philosophy of the Town of Brighton Police Department, some of our training initiatives, our Body Worn Camera program, police discipline here in the Town of Brighton, our interagency relationships with other law enforcement agencies, and community interactions. This chart describes the structure of our department. It simply shows that orders and command flow from the top on down. It's hierarchical in nature. At the very top of this chart shows the elected leadership of the town government. This model also provides clear lines of authority internally within the organization, which allows for command and control. It was last updated in 2018 with the addition of a third lieutenant to add accountability on each shift. Our staffing levels have remained consistent for over 20 years. We have a current authorized strength of 40 full-time sworn officers who work in the community and 6 part-time sworn officers who provide court security and are restricted to the building. We currently have 3 vacancies, which brings down our full-time staff to 37. I've held those vacancies looking specifically for diversity hires. This chart is the town demographics is provided from citydata.com. As you can see from the chart, our community is almost 80% white. However, we are a very diverse community. There are 5 public school districts within Brighton and several private and parochial schools. I know we have one of the larger Jewish populations outside of New York City, but we are also home to one of the largest mosques in the area, which leads to strong interfaith alliances. Even though the nighttime population in Brighton is about 36,000 residents, the population swells during the daytime with large office parks, colleges, and commuter traffic. As you can see here, I've broken this down into college educated, male versus female, in white, and our diversity hires in the lower right-hand corner. I believe that the response rate from the survey that stated we are professional directly correlates with the 86% of our staffing having college degrees. We actually have 3 officers who have master's degrees. Diversity in law enforcement has been a constant struggle, not only here, but around the country, but we have made gains in Brighton. We currently have 5 females within the sworn staff, and one of those has a first-line supervisory position. Women have a place in policing, and research even suggests they actually have lower incidences of force compared to their male counterparts. We continue to identify opportunities for career growth and for recruiting more females into the profession. We currently have 3 Hispanics, 1 Black officer, and 1 officer demographically identified as other, which equates to 11% of the sworn force. Again, we're trying to diversify our police department as much as possible. The civil service laws can be a barrier, not to mention that all law enforcement agencies in Monroe County and beyond are trying to hire the same small pool of candidates that I'm trying to hire. We did promote the first Hispanic captain ever last year in our police department, Captain Jose Caraballo. I hope for more exciting news in 2021 when it comes to diversifying our department. The civilian staff includes all the professionals who support our mission. They just are not sworn officers. These include our administrative office staff, crossing guards, and animal control officers. As you can see, 9% of our civilian staff is diverse. Two of the civilian staff are Black females. Written a little bit about our culture and philosophy. The written policies that we have, they only provide guide rails to the officers. When we get members to internalize our methods and why we do what we do, we win and the community wins. We've been accredited since 1991. We were actually the first department in Monroe County to be New York State accredited. And we actually have reaccreditation in June of this year, which will be led by Captain Michael Desane. Monroe County, if you don't know, is actually the only county in all of New York State that has all of the law enforcement agencies within the county accredited. Further, only 25% of the agencies in New York State are accredited, and I'm proud to say we're one of those. We did a complete and total overhauls of our policies, which started in about 2017 and ended in early 2019. We certainly have come a long way from the paper and pen method, which was very common when I started here 22 years ago. Our current policy management company provides us with a combination of lawyers, which provide legally vetted policies, law enforcement experts to provide best practices, and a way to ensure we have the most up-to-date policies. It would be nearly impossible to keep up to date with New York State legal changes and changes implemented by the Division of Criminal Justice Services, or DCJS, which is the controlling body for law enforcement in New York State. Our policy management company also allows us to have a mechanism to train officers monthly on the policies, and all of that data can be tracked relative to not only policy training, but the acceptance of those policies when they're issued. Our guardian philosophy is created from the hiring standards to the onboarding process to our field training program and our ongoing continual training. This philosophy has been internalized in our members, and we are here to serve the public. We also have one supervisory member for every 3 to 4 officers. They are actively at scenes to assist and provide direction to our young staff. The Basic Police Academy in New York State is a minimum of 700 hours, but here in Monroe County, we're currently over 1,000 hours of training for a newly hired officer. The extra 300 hours of training is to have additional topics that we add here in Monroe County. As you can see in the left column, this is where the basic education of a police officer begins, relating to people from diverse backgrounds. The goal of the Police Academy is to provide a trained officer to enter into a field training program where they can begin the experiential training with a senior police officer who's trained in adult education methods and rating new officers. The training period for a new officer is a minimum of 16 weeks. As you can see, both the 26-week Police Academy and another 16 weeks of field training is a significant investment, not only in time, but in money. Some more of our training initiatives. We provide leadership training to our supervisors so they can effectively supervise and manage their work groups. We've partnered with our risk management provider, NYMER, or the New York Municipal Assurance Reciprocity, to provide a web-based access to several training modules that can be done on a 24/7 basis, which is important because we are a 24-hour service agency, and it helps to balance the fiscal responsibility with the need for training. We have annual and ongoing training that helps produce a well-rounded officer. 100% of our staff is mental health first aid trained. 45% of our staff is crisis intervention training, which is a higher level of training to help interact with people in crisis. Our goal is to have 100% of our staff crisis intervention trained, hopefully in the next 2 years. Those 2 blocks of instruction alone are important because there are studies to suggest that 25% of police-involved shootings involve someone suffering a mental health crisis. And we can provide training to recognize those in distress. We can attempt to de-escalate through those skills learned in that training. Everything I just discussed is an attempt to align policy, training, and supervision, which gives us a recipe for success. The policy guides our decisions, the training assists us in implementing the policy, and our supervision manages the incidents to ensure compliance and provides immediate feedback if and when necessary. When one of these is out of alignment, it increases the room for error. Our body-worn camera program started with a trial period back in 2016. We were one of the first in Monroe County to have a controlling policy when cameras are activated with no discretion when they are activated. As of today, we have over 81,000 video interactions. We tried several alternative cameras, but Axon provided us with a turnkey system. The other cameras could not provide the information technology infrastructure that we needed to provide the back-end support for storage, access, and sharing. Since 2016, we have continually reviewed the capabilities of our body-worn camera system. Currently, our body-worn cameras are part of a robust use of force reporting system where cameras are reviewed at several administrative levels within the organization. Just recently, we instructed the review of each arrest made by a member of the Brighton Police Department to ensure policy compliance, and it also gives us an opportunity to train and correct officers. Police discipline. Both captains either have professional training or will soon receive professional training in conducting internal investigations involving our members. Most of the internal investigation and most of the complaints from those investigations are internally made by either myself or another command officer. Complaints from citizens can be anything from calling 911, asking to speak with a supervisor regarding the explanation of a policy or procedure, up to and including an allegation of misconduct. Looking at 5-year averages, we receive about 1 complaint per 2,000 calls for service. This year, I hope to be able to provide more accurate data than we ever have before when it comes to our complaints, which will be out in our 2021 annual report, 2020 annual report, excuse me. As I said, we have a robust use of force review where each supervisor of the involved officer, whomever that officer reports to, has to review that use of force to ensure its compliance with policy and procedure. We went even further in our use of force reporting. We added a de-escalation narrative in that report where there's a box, and our goal is to get to change the thinking of the officers before using force and up to and including using the force. The wall kill decision. In 2018, the town passed a local law essentially removing union arbitration from the discipline process. What that means with this wall kill decision, it's actually a court case out of the town of Wallkill. What that means is, in essence, a citizen that the elected officials have the ultimate authority on disciplinary matters. In my opinion, there are no better officials to evaluate and consider discipline than the elected officials of this community, because they are responsive to the community. There's no passing of the buck or extra layer of bureaucracy. This slide just represents how we collaborate in Monroe County. Once a month, the Law Enforcement Council, made up of all the chiefs of Monroe County, along with the sheriff and our state police partners, we meet to discuss issues that affect law enforcement in the county and beyond, either in whole or part, and can work collaboratively to solve problems. We also help to direct the training efforts, policy changes, and new initiatives. As I said, just a month ago, all the chiefs of Monroe County agreed to get 100% of their staff trained in crisis intervention training. So all these agencies here work together to share resources when necessary. I like to think that our strength is derived from our partnerships, both internally and externally. We have partnered with the New York State Police to provide assistance at times from their hate crimes task force when an incident occurs in town, or their campus sexual assault task force when a reported sexual assault occurs on a college campus. The Sheriff's Office has provided aid in the form of the Commercial Vehicle Traffic Enforcement Unit, their bomb squad, and even their mounted unit when we have parades. The FBI has assisted us in cold case investigations, and we work closely with them to help guard those institutions who have a heightened risk and higher profile when it comes to targeted violence. The community organizations aid us, the community organizations below aid us in policy development, intentionally or not. Actually, the highlight of our January 2021 in-service training was interacting with Dalton Letta and his friends from Campaign D, an autism awareness group that advocates for those who have autism. It's probably the most fun I've seen our officers have interacting in the community for a long time. Officers even approached me after the training to see how they can build upon that relationship, and I hope to continue that relationship in 2021. The Forensic Intervention Team, commonly known as FIT, if you hear that acronym, is our partner, and we will expand those services here in the town of Brighton. FIT is a service provided through county resources who have the capability to assist us when interacting with those who are experiencing a mental health crisis. We currently work best with FIT in a post-crisis response to ensure the necessary services are being offered and to interact with the community member in a more relaxed time rather when they're in a crisis mode. Another longstanding partner in the community has been Women Child Advocacy Center and Lifespan, who help us in investigating crimes against our most vulnerable populations, children and the elderly. Excuse me. Let me start off by saying that I can't stress enough how much COVID has impacted us in 2020 and now into 21, and how much it's disrupted everything that we do in the community, all the community engagement initiatives that we normally do. This level of engagement has been ingrained in everything that we do for the past 20 years. Each of these events brings about conversations in a less formal setting. For instance, I participated in panel presentations in group settings with the Black Student Unions of McQuaid, the 12 Corners Middle School. I haven't participated with the Black Student Union at the high school yet due to COVID, but my predecessor has, and as soon as it's safe to do so, I'll be getting back to it. We do a lot of community engagement, as you can see, whether it's pizza with the chief, coffee with a cop, our annual bike rodeo for our youth, or even our Police Explorer program. But we're committed to doing more community engagement. Community is actually beyond the borders of Brighton. And I like to think if we haven't learned yet as a profession of law enforcement, that when an incident occurs, say in Minneapolis or here locally, it affects all law enforcement as a whole. One component of the governor's directive is about community stakeholders to include faith-based alliances. I participate with all three listed here on the screen: the United Christian Leadership Ministry, the Monroe County Alliance for Transformation of Community and Police, or MCAT-CP, and the Ministers and Police Alliance for Community Transformation. And I'm always looking to do more, and I've enjoyed the partnerships that I've had. This is where the relationships are truly made, and we can share those sometimes uncomfortable conversations, and we can share our perspectives in a non-judgmental way. As I said, we had a community forum back at Temple Brith Kodesh over the summer, and we had discussions on many of the things that we're talking about this evening. Myself, along with my command staff, attended 5 community forums from Fairport, East Rochester, all the way out to Hilton. We heard and interacted with many community members across a broad spectrum. Some of those recommendations appear in this plan. Secondly, the governor discussed evidence-based policing. The partnerships with Roberts Wesleyan and the Rochester Institute of Technology are going to serve us well in the future. In this plan, you will find our first ever community survey in over 25 years. And I'm proud of the work of our IT, and I'm even more proud of the results returned from the efforts from the men and women of this department. We had 856 responses from the survey. The top 4 responses regarding the interactions with the Brighton police were professional, respectful, helpful, and fair. Further, on page 7 of the RIT report, 90% of the respondents reported Brighton police having a positive relationship within the community. That number alone speaks volumes to me about the men and women in this department and how they interact with the community. Compassion and empathy are values we instill in our members as soon as they're hired here. I do believe we as a department get it right most of the time. It's not to say that we're perfect, but as the survey shows, I think we're on the right path. I'm still interested in more effective outreach to the community and even to the marginalized community, and I recognize that. I'll let the survey speak for itself, and I'll only share a brief synopsis tonight. The survey is attached to the plan, and I hope you all get a chance to read it. This is just a slide from page 16 of the survey that demonstrates how satisfied people were that had interactions with the Brighton Police Department. Over half reported being very satisfied. These results indicate that respondents were overwhelmingly, this is a quote from the report, these results indicate that respondents were overwhelmingly satisfied with their interactions with the Brighton Police Department over the last 12 months. This chart is from page 22 of the survey regarding the safety and quality of life in Brighton. The numbers are pretty good, as you can see, with 82% who agree or strongly agree that we take care of the overall safety and security of the community. Even in the marginalized, the respondents received a response rate of 70% who believe we take care of the community's overall safety and security. When it comes to maintaining the quality of life, I look at the 57% rating in the marginalized community, and this is where I think work needs to be done. 57% is not bad, but I think that we can do better. And I'm committed to having effective, targeted outreach to those marginalized members of the community. Some of the recommendations you'll find in the plan. I do plan at our first staff meeting this year, I've committed to bringing procedural justice to our department in 2021. That's one of the goals of the department. Much of our training involves components of de-escalation, whether it be mental health first aid or our crisis intervention training. I do plan on bringing more de-escalation training to our department to ingrain those concepts into our culture. We did the 21-day challenge to create dialogue among staff and then followed it up with in-person racial and diversity education training, even though it had to be done via Zoom. We're a well-educated department with 86% of our staff having a college education. And I think the most common response from the survey with a description of professional bears that out. We're always looking for ways to expand our training initiatives, especially to aid us in assisting marginalized communities. We have an officer who partners with a member of FIT, or the Forensic Intervention Team, that does post-crisis follow-up to those who have experienced an emotional crisis in the community, and this model serves us well. We had over 400 contacts in 2020. We have other members assigned as liaisons to aid our efforts in building bridges and creating relationships in those marginalized communities. And in 2021, I will look for ways to expand those efforts to create those relationships. The mission of the Brighton Police Department states that the principal mission of the Brighton Police Department is to serve and protect the citizens of the town of Brighton, remembering that the police must serve all citizens impartially, respecting the rights of individuals regardless of race, creed, color, or origin. My plan is to identify leaders of those marginalized communities in those groups and conduct a targeted outreach when it's safe to do so. Again, hopefully we can get back to a more robust community engagement when it's safe to do so and restart such initiatives as a Citizen Police Academy, where citizens have an opportunity to interact with their police. I understand the importance of diversity in law enforcement, and I'm committed to doing better. We have a survey currently in the field to assist us in answering how best to identify and recruit a more diversified candidate pool. Remember, we're competing against every other agency in this county and beyond to diversify our departments. I've spoken to young people in diverse groups like the Police Career Exam Prep, which is assisting putting diverse members into a law enforcement career pipeline. We have a Brighton Police Explorer program, and youth from even outside of Brighton participate. And it's a great way for our youth to explore careers in law enforcement. Promoting the diverse workforce is dependent upon members taking a civil service test and being able to score in the top 3 to be promoted. Hiring new officers requires the same rule of 3. And again, we compete against every other agency in this county trying to diversify their workforces. For transparency in our process, I plan on inviting a panel of citizens to participate in the interviewing process to make sure we are getting the right candidates. We started a community engagement initiative back in 2013 to create better bonds between the officers and the community. In our annual report, we actually started tracking these community engagement initiatives to identify our progress in this effort. Over the last 2 years, we averaged about 27,000 self-initiated calls for service, which include foot patrols, structured traffic patrols in neighborhoods, and giving special attentions to those institutions in our community who may have a heightened sense of a security threat. As I mentioned before, we have several initiatives such as DARE, Car Safety Seat Inspection Program, our annual bike rodeo, and something as simple as officers getting out of their cars, walking at the farmer's market, engaging with the community. And I look forward to engaging with the community, hopefully next month when it opens. These are all initiatives that will continue when it's safe to do so. This entire slide to me represents communication. Every time we interact with a citizen reporting a crime, we give them a victim's rights card with the officer's contact information, and we reinforce that message to staff every chance we get to circle back with those crime victims and those reporting incidents, to follow up with them and see how they're doing. Yes, I do agree that FOIL can seem cumbersome at sometimes, but it's the best method that we have to ensure the right people get the right information, and we don't release anything that could cause an unwarranted invasion of personal privacy. Our new computer-aided dispatch system and records management system will be going live soon. Once it's up and running and all the bugs have been worked out, we should be able to have more immediate and reliable data to report to the community. If I can incorporate a dashboard, if you will, to improve upon what we already do with our twice-a-week police blotter or our once-a-year annual report, I will research such an option. I'm already gathering new data for our 2020 annual report to include as much demographic data as we can provide on whom we're interacting with in the community, from traffic tickets to arrest data. Another recurring theme from the survey is my support for the Black Lives Matter movement. The chiefs of police in Monroe County issued a statement shortly after the murder of George Floyd in Minneapolis. And as I said, I actively participate with 3 faith-based alliances where the hard work is actually done. I've also spoken to several different Black student unions or groups about these issues. I will continue with those outreach efforts when the pandemic subsides. But yes, unequivocally, Black Lives Matter. We are still learning, and I plan on continuing the necessary work to provide the community with the highest level of service possible. I'm not sure what those responses will ultimately look like or what the cost will be, but our research will continue into the most appropriate alternative responses. Everything that we do here is aimed at being the most professional organization we can be and not resting with only being good. Everything we've been doing here in 2015 is being done in alignment with President Obama's 21st Century Policing Task Force. So I like to think that we have a head start on many agencies. That task force report positioned us 5 years ago to where we are today. I think we do pretty well on all the pillars, but we have much more work to do in building trust and legitimacy in the community. And it's a constant theme I hear from the community forums and groups that I attend. Communication and transparency are the main objectives of this effort. Just remember that this is a draft plan. It is not the end, and it won't be put on a shelf where it's going to collect dust. This is just a jumping off point and will guide us for the next 5, 10, or 15 years. I thank you very much for listening to me this evening. The draft plan is out on social media, on our Facebook page, my Twitter account. It's been in the media. So please, I really do want to hear your comments at communityinput@townofbrighton.org. I thank you for taking time out of your evening tonight. I know we all have busy lives, but I wouldn't want to be anyplace else. Mr. Supervisor, let me clear my screen and I'll turn this back to you. Okay.
Thank you, Chief. Appreciate the presentation. And we've gotten a number of questions during the presentation, so let me jump right in. The first one says, the level of training you described sounds great. I especially applaud the crisis intervention training. Yet I'm concerned about possible conflict with other training. A recent report on NPR referred to training that reinforced paranoid feelings by police, that every citizen encounter is an opportunity for the police officer to be severely hurt. If you could comment on that concern.
Well, I can't comment specifically on that report, but it goes back to the guardian versus warrior mentality that we have here in Brighton. As I said, I've been in Brighton 22 years, and I don't remember a time when we've instilled a warrior mentality where we approach citizens in that manner. The mental health first aid training that we get, 100% of our staff in the crisis intervention training, which is a higher level of training, it enables us to not only recognize a person in distress, but be able to assist that person in distress. I don't condone any officer or any training that puts us in an adversarial setting. Not to say that we don't get put into adversarial settings, but we don't approach them adversarial in nature. It is the guardian philosophy that we instill in our members.
Thank you.
And excuse me, if you'd like to forward that report through the Q&A or community input at townofbrighton.org, I'd be more than happy to look at it.
Great.
Thank you.
Thank you. We do have a couple of questions that relate to mental health issues, not surprisingly, given the significance of those issues, particularly in light of some of the significant community incidents during the past several months. So I'll read the first one. I appreciate all the work you are doing. Could you please expand on what you mean by, quote, expanding Brighton's response, close quote, to mental health beyond just engaging the FIT team? What will we be doing specifically in Brighton to include mental health professionals in the response to our community members in crisis? Thank you.
So a couple things. I've been appointed to sit on a committee of law enforcement chiefs. I didn't watch the press briefing today by the county executive. He is adding many more members to the FIT team. Currently, as I said, our response model, we do a lot of post-crisis follow-up, and that seems to work very well for us in Brighton. When FIT is fully staffed and when FIT is fully up and running, hopefully that model will look like they will be able to respond to calls with us proactively rather than in the post-crisis follow-up. But again, it's going to take time to upfit and onboard those members through the county. It is a county entity that provides FIT to us. And I'm looking to explore any avenues. I know there's many different models out there. I've read about the CAHOOTS model. I've read about different models across the country. And what I keep coming back to, it is very difficult for us to determine when a mental health crisis is going to happen, where it's going to happen in the community. That's difficult to predict, whether it's 2 o'clock in the morning or 2 o'clock in the afternoon. So you have to have FIT members out in the community during those times. What's worked very well for us is the post-crisis follow-up, where we can go back and engage with that person suffering that crisis to make sure that they're getting the services they have, so it doesn't become a chronic call. I hope that answers your question, but that's still evolving. It is still evolving.
Thank you. And I'll just note that I know the reason the chief wasn't able to be at that event today with the county executive and other law enforcement and mental health professionals. He was in a meeting with the leadership of one of those faith communities that is involved with this report. So even Dave Cathaldi can't be in two places at once. I'm going to jump down to another mental health related question. The question asks, it's unclear what the mental health and crisis training for officers actually is or will be. I think this kind of training is and will be useful. I also believe there's a place for law enforcement officers in our community. However, there are professional mental health workers who have years of education, experience, and training to handle mental health crisis situations. Shouldn't they be the ones to handle such situations and law enforcement officers handle situations that they are appropriately trained to do? This can be a win-win situation with both law enforcement and mental health professionals providing safety for our community.
Sure, quite frankly, I don't necessarily disagree with that. As I said, the county is going to be standing up that FIT program, hiring more people. That's not going to happen overnight. That's going to take days, weeks, and months. And it's very difficult to predict a mental health crisis. For example, the way calls come in through 911 may be something totally different than what a mental health crisis may be. I mean, I could give you example after example. For instance, a very routine call in Brighton is something known as a check for welfare, where maybe a family member is concerned about somebody. They haven't heard from them in days, or their mail's piling up at the door. That necessarily wouldn't trigger a mental health response. So if a police officer goes to that scene and encounters someone in a mental health crisis, it's an immediate need. We have to provide a high level of training for those officers. You can do research on mental health. If you type in mental health first aid, we actually sent an officer 2 years ago down to Atlanta, Georgia for a week to be specifically trained in mental health first aid. She brought that training back to this department. We recently certified this year. She trains other members throughout Monroe County. So like I said, it's very unpredictable. In the nature of the calls don't always come in as mental health crisis. But as I said, there's one statistic out there that's alarming. 25% of the officer-involved shootings occur when someone's in a mental health crisis. So I have to ask myself right now today, what is the immediate need of this department? And what does the immediate today response look like? And I like to think we're ahead of the curve providing that training to recognize those people in crisis and get them the help they need to de-escalate the situation versus having an untrained officer in mental health first aid or crisis intervention training that doesn't have that skill set. It's a recipe for disaster. Ultimately, yes, I would like to see the social work response, but that is a county response. We don't have social workers employed here in the town of Brighton. That would be a whole nother organization of government. And my boss is on the line, and he holds the purse string, and he can
Well,
talk more about that if you choose.
You know, Chief, it is obviously our intergovernmental work. You've talked about it in the law enforcement context, but in this county, we are fortunate. We do work, and we work across the aisle. We have Republican town supervisors. We have Democratic town supervisors. We work with a Democratic county executive, a Republican district attorney. And I do agree, it's going to be vitally important that we increase the resources devoted to mental health responses that now, as we've again sadly seen in the city, what are clearly mental health incidents go without a mental health response. That does need to change. But I do agree, particularly you know, given the magnitude and the unpredictability of it, having a county, a broader ability to respond to those mental health issues is probably the more practical, realistic. If we had two or more situations at one time in the town of Brighton, we could very easily tap out our resources. So, but I think it's something we're going to have to look at and work together with other agencies and other levels of government, frankly, hopefully very much the state of New York, because ultimately those are programs that are not going to be cheap, both from a training perspective, an ongoing training perspective, integration of the mental health side and the law enforcement side, and of course the direct personnel side.
Yeah, and one more thing I forgot to mention, some of that diversion is occurring already. If you were to call 911 and they have the ability right now today to transfer you to 211 or Lifeline, as long as it meets a certain set of criteria. For example, if there's no one that's injured, if there's no one that has a weapon, if it's a first person caller, which means, in other words, I'm not calling about the captain, that call can get transferred to 211. That's occurring right now in the community.
And that 211 response is also going to be enhanced in the very near future. Okay, let me go to the next question. First starts by thanking you, Chief, and the members of the department who worked long and hard in coming up with a well thought out and comprehensive response to Executive Order 203, and for consistently being a department that stands as a model for what policing should be. As a member of MCAT-CP, that's a tough acronym to get out, which has worked with the chief for several months, stated at yesterday's closing meeting, we wish we could clone Chief Cathaldi in every department across the county. Thank you for that, Sanjay. His question is, how is the town and the community going to support officer mental and emotional health? They have extremely difficult jobs that get even harder every time an incident occurs outside the department, as communities, particularly marginalized ones, can develop distrust of police at large. In addition, this call for substantial change, even though it is positive for all the reasons the chief has cited in his report, will add further emotional strain on the members of the BPD, as change in any organization does. So really the question is the mental health of the officers.
Well, I'm glad you mentioned that. I actually, it's funny you mentioned that. I actually had a conversation today at 5 o'clock with a member. We brought our employee assistance program, our provider from the University of Rochester. They were here at our winter in-service training in January. And it was really an introduction to them in the program. We've done it in the past just to try to be it was twofold. It brought us some de-escalation training and communication skills, but what it also did is it introduced them and reintroduced them here to staff. I think I know where you're going with the question. There is a stigma associated with police officers reaching out and getting that help. It is something we struggle with. I've had to make referrals in this organization and assist officers to reach out and get that help. I think it's a win-win for us. It's actually a part of the executive order. We are going to have more training coming up at our spring in-service in actually our summer in-service in June to try and implement that program. I know the Brighton Fire Department and Chief McAdam is a part of a peer support program here in Monroe County. We've utilized, and I've had conversations with him in the past to bring it here into the organization, but it's that stigma and it's getting the officers the help they need and getting past that. But I hope I answered the question, but I mean, we do have EAP for our members. We've used them in the past in group settings when we have traumatic incidents. And we'll keep building those bridges here in the department internally.
Okay, the next question. The Brighton Police Department mission says, quote, the principal mission of the Brighton Police Department is to, we got a new question in, so my screen moved on me here. Okay. The principal mission of the Brighton Police Department is to serve and protect the citizens of the town of Brighton, close quote. Do you think this statement is sufficiently broad? What about those who may not live or pay taxes in Brighton, but who may visit Brighton to go to work, to provide services, to shop, play, visit family, or just pass through on their way to another destination? Does this statement foster an institutional culture of other or outsider?
That's a good question. That's a good question. So
I thought so too.
That's a good question. And I would thank whoever that is for drilling down. We may have to revisit that. We actually, and I'm not sure what, it might have been MCAT CP where we started this conversation of community and what you would think everybody would understand what community is. It is not just Brighton. As I said earlier in my report, an incident that occurs in Minneapolis or here locally, but outside of Brighton affects us here locally. One of the things that I wanted to do in our survey, I didn't want that survey only to be Brighton residents, because I hear so often from members of the community. Just last week, we had a chiefs meeting here in this room, and with another faith-based alliance mentioned, and she relayed how she feels driving through the town of, I won't give the town, and how she feels that she's followed and she just feels out of place. So that is not lost on me. It's not just the residents of Brighton. We have people that drive through Brighton. We have people from out of the county that drive through Brighton. Say going to the U of R, one of the larger employers right down the street. So point well taken. Point well taken.
And the chief cited that statistic that while our population may be 36, 37,000 at night, during the day with the U of R and the many large employers, it may be a little less now with fewer people actually working in offices, but we know that at times during the day, there can be close to 100,000 people in Brighton. Yeah. So it is a very perceptive question. Thank you for that.
Can I say one thing, Tom?
Sure. This is Captain Mike DeSane.
To steal a quote from you yesterday on the paths, the trails, it's about connecting the community. And you mentioned that from the Highland Ave to Clover Street. It's the same philosophy for us. It's about connecting the community as a whole, not just Brighton. We understand the large influx of the population throughout the day, and our officers are well aware of that. So I just want to point that out.
Question. Thank you for all the hard work. We appreciate the professionalism of the Brighton Police Department. What percentage of time does the average Brighton police officer spend training versus policing?
A percentage-wise would be difficult to answer. As I mentioned, we're an accredited law enforcement agency, so each officer has to have a minimum of 21 hours of training a year. That's really not a lot. So we far exceed that. As far as a percentage of training, I don't have that statistic to tell you how much we train. I can tell you it far exceeds 21 hours of training. It's sometimes, I'll be honest with you, sometimes the officers feel that they're training more than they're actually doing police work. But I think you're going to see that. I know you're going to see that training increase even more this year, because there's a lot of initiatives that I want to do. I mentioned I want to do procedural justice training, the racial justice training that we did back in January. So we're going to do even a lot more training. So it is going to, I don't have the statistics, but I can probably look that up for you. If you capture that question, I can get that number for you.
Next question, you'd mentioned that you had not filled some vacant officer positions as you strive to diversify our force. Has the town ever considered using some of the funding towards hiring mental health crisis intervention professionals? Sort of goes back to what we were discussing a minute ago.
Yeah, and I also just want to, You know, when I said I held that spot, we currently have 3 spots. We just had a lieutenant retire last week. I've held actually 1 spot. We have been in communication with some members who may want to come to the Brighton Police Department, which would help better diversify us. So I've held that spot in the hopes of better diversifying this department. Once you start getting down below 30, I mean, we're at crunch time now because, you know, you have training hours that you have to fulfill, and we're a 24/7 agency. When you factor in training hours, time off, injuries, other types of leave that officers take, it really becomes a balancing act. And the lower you go in staffing with patrol members, people out there on the road answering 911 calls for service, it starts moving the overtime up. So there's a trade-off there.
And the more overtime, you run the risk of some of those concerns with the health and well-being of the officer.
Sure.
And I'll also say, you know, it wouldn't be fair to put all of that on you. Obviously, that is also in part a budget question that the town board reviews each year, the budget. I think people know that law enforcement is one of the largest items in our budget, and we are weighing a number of different and competing interests. I guess I would say it is my hope that, given the nature of the need for mental health involvement in calls, the more of that we can do at a higher agency level, for example, at a county or regional level, I think we will be able to provide those services more efficiently. I look, for example, and it's very different, but Strong has the mobile stroke unit. And I see the mobile stroke unit go down Elmwood Avenue. I don't know if it's going to a victim in Brighton or a victim in Penfield. It would be very expensive for each one of us to have a mobile stroke unit and having services like that regionally. But it's a good question. It's an important question, and one that we have to ask as we try to allocate the scarce resources that we have. I'm going to. This is more of a comment. As most of you probably know, one of our ongoing initiatives is working with our community volunteer idea board, the Inclusion, Diversity, and Equity Advisory Board. And among the several undertakings that the idea board is working on, they held what are called World Cafe sessions, again remote, during 2020, where people were able to engage in a number of issues relating to inclusion and diversity. And the question really is to clarify that it's your intent to incorporate feedback from the idea board, and several members of that board I know are here tonight, as well as feedback from the World Cafe community sessions into the report and potentially into recommendations.
Sure, a couple of things. Mr. Supervisor, you know more about, I did a presentation for the idea board, I think it was last year, and I'll be meeting with them again, I believe in May, I think it is. They've asked me to come back. So two things. Yes, I do want the feedback. I think that the feedback from the idea board could help us, whether it's in time to submit with this plan or we have to do an appendix to the plan a month later. I think we can work out those logistics. But here in the town of Brighton, you know, there's so much focus on police and on what police do and how police interact with the community. And I'm going to give kudos to the town and the town board and the supervisor. They implemented an idea board, what, a year and a half, 2 years ago? maybe even longer than that. So it's a holistic approach. It's not just the police department. It's a whole plan for the entire town. So I think that shouldn't be understated. That should really be, I'd like to see it incorporated, and anything that we can do to bring that in, I'm all for it. They're a stakeholder.
Thanks. Yeah, the chief references the fact that one of the primary missions of that idea board, and one that they are working on now, they've broken into subcommittees to do this, is to develop a diversity and inclusion plan for the town of Brighton. Frankly, that's an area where the public sector, particularly the local government sector, is behind the private sector. When we finish our diversity plan, I anticipate we will be the first town in upstate New York to have one. In fact, we had to go all the way to Beaverton, Oregon, to find a plan that we saw that really melded well with the kind of community we are. And in fact, just this past week, I participated with the idea board in a Zoom meeting with some of the leadership in Beaverton, Oregon, talking about their plan, and as you referenced, the implementation of that plan. Because the work with the idea board and the work with other groups in the agency, you noted, not all of the materials, not all of the reports, not all of the data has been completed. We're going to be learning more over time. And while we have to submit this plan to the state of New York by April 1st, it is a living, breathing, and implementable, and the need to implement document. And as you do that implementation, you'll learn more and flesh it out more. So, but I'm glad, thank you for giving the chief the opportunity to clarify that. I have another question, and I'm not going to mention the name, but I think, Chief, you will recognize the situation. She asks, why did you send a police officer that I was scared of rather than someone in normal clothes when there was a misunderstanding about my well-being? I was not in crisis, but it upset me.
So I'm not 100% sure. I think who it is. I think I may know who that is. As I said, even during my presentation, we do pretty well. We don't get it right all the time. We need to make sure the first thing that you're going to hear from a fireman or someone from the ambulance is to make sure a scene is safe. After the incident that occurred in Webster, there's a whole shift in the mentality of first response. After that incident, police were responding more and more with fire and ambulance just to make sure scenes are safe. And we've had conversations, I believe, if it's who I'm thinking of, between myself and I don't want to get too far into the specifics of it, but sometimes we don't give that personalized service. It's not like it was 25 years ago where you could call a desk number and speak to somebody. Just to let everybody know, if you go on the Town of Brighton website, go to the police department page, you'll find my email address on there. And you'll find my desk number. It's not hidden. Contact me with these individual questions and we will work through them. If I have to invite you to my office, if I have to set up a three-way Zoom call, we'll do that and we'll work through the problem. That I will promise you.
And he means it because I've seen him do it. Thanks, Chief. This is a question for me, actually. William Maley, you mentioned regionalization with mobile stroke units. Wouldn't Brighton benefit from looking into regionalization compared to the fact that our resources are limited as suggested earlier? And I believe the question relates to a regional law enforcement agency. And I'll give my thoughts on that. I do not support Metro Police. A lot of people have heard me say this. I think the town of Brighton, with its population of about 37,000, really is in the sweet spot in terms of being able to provide very professional services, and yet at a size and scope where there is still personal level interaction. Chief Cathaldi giving out his direct phone number. That's simply not something that's going to happen in a lot of institutions, particularly larger institutions. I don't want to point the finger at other agencies, but given what I have seen, what we all have seen from other agencies, and the accountability or lack thereof of other agencies, I would be very concerned taking lines of control farther and farther away. We mentioned earlier civilian control of discipline. The fact that we have civilian control through the elected officials of discipline here is something that we are able to do because we have a local town level police department. We're able to adopt and maintain that guardian philosophy of policing that, frankly, and it's not just an urban versus suburban, because I think there have been times in the not too distant past where we've seen other suburban departments not engaging in a community police philosophy as I believe they should, and I believe we do overwhelmingly. So if the question is, do I think we should merge our police department with other agencies? Absolutely no, I do not. What I do, and he's clarifying here. I asked if Brighton would represent from regionalization. Well, if I believed it would, I would say yes. I don't believe it would, but what I do believe is that for certain specialized services, and the chief mentioned some of those earlier in his commentary, also things like water rescues, for example. There are some areas where there are specialized services that are provided, like the stroke unit, that other agencies can call upon. Do I think we should have a regional police department? Do I think that would improve on the level of service that the Brighton Police Department offers? No, I don't. And no, I don't support that kind of a regional approach. I think we have answered every one of the questions that has come through the chat. If there are any other questions, again, you'll all have the opportunity. If you think of something at 9 o'clock tonight, send an email, communityinput@townofbrighton.org.
Mm-hmm.
communityinput@townofbrighton.org with any further questions. But I want to thank all of you that came tonight. I want to especially thank the people who have been involved in answering the surveys, participating in the event over at Temple Brith Kodesh, and really engaging with the department. Your input tonight and your input on those other occasions are important. Let me just mention here, we dropped the ball on something tonight. We do not have an ASL interpreter with us tonight, and for that I do apologize. We should have had one. What we're going to do is see whether we can get closed captioning. As I said, this video has been recorded, and if we can get closed captioning through our YouTube We will do that, but we should have had that ASL interpreter as we do at all of our board meetings. And so to the deaf and hard of hearing community, I apologize for that. I dropped the ball on that. But if there are no further questions, again, thank you, Chief. Thank you, Captains Mike Dezane and Jose Caballo. We look forward to working with the entire community, not just through April 1st, but going forward. Have a great evening, everybody. Stay safe.